You are watching CIOTV by Enterprise IT World, a production of Accent Infomedia.
I think there is a paradigm shift which is happening. So if we see our households, the TV, fridge, uh, for that matter, a digital thermometer, an oximeter, that has taken place in one of the cupboards of every citizen across, especially in the metros. And those cannot be achieved without technology.
Hello and welcome. You're watching CIOTV.live. In this series of interviews, we try to understand the perspectives of CIOs and IT leaders on various technologies and their strategies. On our show today, we have Mr. Manish Kisore, Head IT Group in Health, AMTZ Limited, Visakhapatnam. Thank you so much, Manish, for joining us.
Thank you for having me here, Anisha. Special thanks to Sanjay Ji, Enterprise IT World and CIO TV Live for giving this opportunity.
Manish heads Health IT, Digital Health and Training for AMTZ Group of MedTech companies. He's a technical advisor, committee member for METI and Niti Aayog Digital Social Projects. He's the winner of more than 15 national and international awards and regularly as well as voluntarily contributes to several healthcare informatic programs. So it's such a pleasure to have you with us, Manish. Now, yours is a health tech company. Without technology, what would your company be? What is the core technology that you use for the services that you supply?
Yeah, so we are a government enterprise and AMTZ is known as India's first integrated medical device manufacturing ecosystem. And so I can tell you technology is now in forefront. And just to give a background of AMTZ, it has a span of land across nearly 300 acres with current 94 manufacturing capacity in action. And we have, for innovators, 2 incubation centers, Medivalley Atal Incubation Center under Niti Aayog and BioValley under BIRAC, Department of Biotechnology. So in order to complete the complete ecosystem for biotech, what we did was for trainings and certifications, we have Indian Biomedical Skill Council. So during pandemic, what we have seen is huge purchases of ventilators, oxygen concentrators, and many more medical devices. And all of them require prevention and corrective maintenance. So we build capacity of trained, certified biomedical engineers across India. And last year, we also started MTech in medical devices so that the trained engineers are there. So it is being started at National Institute of Pharmaceutical Education and Research at 4 cities. And for masses, we are starting another master's program, which is launching next academic year with collaboration of SkillLink. So what we do as an ecosystem is we have scientific labs across facility, which is common for all the manufacturers. We have multiple center of excellence like additive manufacturing, medical electronics and biophysics and more. And another arm, which we have, Kalam Institute of Health Technology, which aims to focus research on critical components pertaining to medical devices by supporting institutions involved with R&D, industry policymakers, and knowledge repositories. So what we do, we have put the complete circle and put technology around all the companies across, and we support in the complete ecosystem.
All right. So as much as I understand, this whole ecosystem for health and health tech, including training, is what AMTZ is doing. Now, I also read that you also have mobile labs. You tied up with Uber to have oxygen given to patients during the time of the pandemic. So what are these functions? What are these services?
So during pandemic, people were restricted at home. And now how to enable it? So we launched iLabs, which is a mobile testing lab, which can go to remote areas and do the testing and give the report right there and then. So we are now advocating to health at home, basically. So during pandemic, what we came across is now a lot of oxygen concentrators are required. And there was a black marketing across, people were buying in lakhs, and which is required for only few days. Now, what we did was we democratized the technology here. Now, what we did was we started a program called O2 Home with that, which is an oxygen concentrator program. It's an affordable medical oxygen concentrator rental program, which we collaborated with Uber. So it does doorstep delivery and pickup for more than 100 cities across.
Okay. So this sounds very exciting, but what is the technology behind this? And I mean, sitting in the capital of the country, I didn't know such a service exists. So
Yes.
how do I access it? And what is the tech driving it? Are you using analytics? Is there an app? Are you using cloud supported infrastructure to support this service? Could you give us a few details there?
Yeah. So we live in a world that's connected wirelessly with almost as many cellular phone subscribers as there are people on the planet. So I hope you agree with me. So the mobile technology offers tremendous opportunities for the healthcare industry to address one of the most pressing global challenges, which we'll have to look at healthcare more accessible, faster, better, and cheaper. So our O2 Home program is a mobile app-driven program, which is hosted on the cloud, and it is being used with latest tech stack. And to add on to it, we have placed an AI engine on it. So let's say you who uses the oxygen concentrator? It is for respiratory and lungs. So what we did was we did an AI to check your lung assessment. So you cough it, and we will tell you what is the risk that you're at. So it makes you more easier in that do you actually want oxygen concentrator? And it is as affordable as 150 rupees per day. And you can buy from 100 cities available across India. And you can select the number of days you want. So a mobile application, AI on top of it, cloud hosting. And so we have used all these together. And we are using Internet of Medical Things in coming days to connect the oxygen concentrator to the cloud.
How does that work, and what purpose does that serve? Internet of Medical Devices, information goes straight to the cloud, and how does that help?
Yes. So like all medical devices take a lot of vital parameters from the patients. Now, is it the machine working properly? It's a mechanical and electronical combination. So all the medical devices have electronics and mechanical components. Are they working properly or not? So what we are going to do is connect those through Internet of Things, Internet of Medical Things, which will be sending the data to the cloud. And through the mobile app, it is already connected. We can give a preventive alert to the patient saying, okay, this is something which is going away, you can send. So what we have added another piece to it is a call center support where a biomedical engineer would be sitting and would be connecting. So a customer wants anything, he can dial the toll-free number and give the order number to him, and we can guide him. And all these vitals will also be shown to him. Now here, another piece is important is the data protection and privacy bill is upcoming. Now, how do you ensure that the patient consent and all those names are anonymized? We don't use them for it. So we have put an algorithm to it where we do not capture all that data. It is only the essentials which is required for patient safety is being captured.
All right, this sounds very interesting. But the company came before the pandemic happened, but some of the solutions seem to be tailor-made for the situation in the pandemic. So I'm trying to understand about your company. How large is it? How in the IT team, the digital team, how large is it? And how many people do you employ?
So in pandemic, there were only two people, myself and another person who was taking care of infra only. We didn't have development team. We didn't have digital service team. And so, in fact, there is a book made by our eminent leader and MD, Dr. Jitendra Sharma, which talks about made in lockdown. So AMTZ was made in lockdown. Now, currently, we have a lot of verticals within IT, which are taking into action. Is we have full development team in-house, we have ERP team, we have emerging technologies like AI, ML, IoT, and blockchain team separately. We have analytics, which works on big data, which is working currently. And we have full digital services team, which takes care of O2 Home, another program called Techola, this iLabs and mobile oxygen wheels on wheels. We have a lot of other programs which are coming, which is bringing health at home. So you don't need to come out because it's pandemic. We have learned to stay at home.
Okay, but you know what's happening now is we've got another COVID variant, Omicron, around the corner. So you said that during the pandemic, your digital team was just two members. Now it's expanded. Now, what is your preparedness for work without a hitch? Do you have a plan to work in a hybrid condition? Your team is larger, but you want the services to keep flowing uninterrupted because they're designed for the pandemic. So what kind of work structure are you looking at?
See, I think we come in essential services and have to work for nation during pandemic kind of emergencies. And we have really worked hard during pandemic to make sure that we have capabilities and capacities to handle the next challenge which we have. And what we see is during this pandemic, we have so there are a few things which is very important is manpower for manufacturing, the supply chains for us, which is required. Now, can we go indigenous in other than manpower? So what we did was we have reduced the import dependencies from greater than 90% to less than 65% in these 3 years. And most of the work has happened during the pandemic.
Okay. So that's a great achievement to indigenize because the risk of supply chain outages remain very high. And we're seeing a repeat of that around the world. Now, that's a good thing that you're sourcing locally. But if there is another lockdown, in case this Omicron thing really spreads very fast, say in January, then how do you plan to keep your supply up if your vendors are going to be facing a lockdown? What happens to the labor that comes to the manufacturing site? What kind of plans do you have if such a condition should arise?
So we are a government enterprise and closely work with government agencies. And since we are in essential services, we have passes for all the manpower which is working. Now there is another risk of the manpower being exposed to the pandemic COVID situation. So what we did was we have installed thermal cameras and Bluetooth location of all the manpower which is placed. We ensure that we trace each and every manpower and who was in touch with the other persons. So yes. So we can isolate and quarantine those set of people to ensure that it doesn't spread across. But at the same time, we'll have to ensure that people are there to manufacture, to make sure that oxygen concentrator, ventilators are available to the public.
Definitely. People would require that in case a need arises, given that a new variant is around. Now, you said that your digital team expanded during the pandemic from 2 people to those taking care of many different aspects.
Yes.
So could you give us some examples, like the analytics team? What projects are they working on, and what more do they want to do in the days ahead?
So see, we have a lot of data. We have a lot of data coming across. Starting from so let's say we are working on a lot of electronic medical records with ABDM, and we are making sure that analytics run on all the patients' data. It is being stored. So we have another department called Health Technology Assessment, which we are doing for Government of India. So we do a lot of technology assessment. We report, we make it for policy across India, and make sure that that kind of analytics goes to the agencies who are working towards policy enablement. That is one piece of it. Second is, let's say, for example, a CAT scan, CT scan, or an MRI. Now, apart from analytics, we have to analyze, store the data of the patient and make sure that it is rightly analyzed by the radiologist. So,
okay, but where are you getting this data from, and who are you giving these analytics to?
So we have a team of analysts which is sitting in-house, and the data is being generated across India at various hospitals, clinics, government.
Okay, so you're getting data from private hospitals and government hospitals when they run these tests?
Yes, based on the partnerships. Yes, based on the we do a lot of clinical trials here.
Okay.
Yeah.
Okay, great. So we got the what the team on the analytics team is doing, and this is really cutting edge work because India does have a digital health mission which has been announced by the government, and I'm sure this program will also be an important part of it, right?
Yeah.
Right. So from your manufacturing facilities where you are getting medical devices also up and going, I believe, the way you describe a lot of it's embedded with research, and you're doing this indigenous research as well. So when it comes to manufacturing operations, are you using automation? Have you executed anything around RPA?
RPA, not exactly. We are planning to do it. We have done some trials around for specifically the outgoing material from our zone. That piece we have tested on RPA, but not exactly. But we are working on a lot of intelligent automation for the manufacturing, automation in the processes, warehouse, supply chain. So those pieces we are definitely working on.
Okay, so you are automating some of these processes, right? Right. So you did say that you use the cloud extensively, and you want the data to go straight to the cloud, even the readings of the oxygen concentrator. So what kind of cloud services do you use? These are private cloud or a public cloud? And what has been your experience with the cloud? How important is it? How important a piece is it in this entire puzzle where your operations are concerned?
See, during pandemic, we will not get servers and equipment to set up a data center here. And currently, the semiconductor challenge we already have. Now, how do we quickly adopt to the pandemic and make sure? The cloud has recently been very, very, what I say is effective in deployment, scaling, and using much different tools like AI. We have SageMaker in the AWS, Azure has different tools, GCP has different tools. So we are using almost all the cloud service providers. In fact, next step during this second wave and the upcoming wave, what we are planning is to set up 2 megawatt tier 3 data center in-house in AMTZ. Okay. And this would feed in all the medical device industry, connect with their Internet of Medical Things. And so we are working really hard towards it.
So then it will be like a hybrid, part data center and part cloud.
Yes, it will be a fully cloud center, which will be used by all the manufacturers in the zone and the healthcare industry.
Okay. What has been your experience with the cloud? You're saying that you're getting a data center. So going ahead, how much of the processes do you see moving to the cloud? Is everything on the cloud now? What is your plan for the future?
Yes, I think we will be going 100% on cloud.
By when?
I think by next financial year, we should be 100% on cloud.
All right. What about cybersecurity? You spoke that, the data that you're collecting is sensitive. This is health data, right?
Yeah.
And you're completely on the cloud, or plan to go completely on the cloud. Plus, in a hybrid or remote functioning, entry points are multiple now, right? So how do you protect data integrity?
See, there is one term called validation in healthcare industry. Now, any and every data has to be validated. all the computer systems. So there's a term called CSV, computer system validation, and it is as per the FDA and European norms. And so we'll have to ensure that any and every data is validated. And healthcare is the first industry to have the policy of data protection and privacy being launched, even before the bill was there. In terms of cybersecurity, I think we have deployed XDR solutions with an endpoint security being given to all the employees. And we are doing a lot of poster awareness for them. We are conducting a lot of trainings, which is compulsory for security awareness, and making sure we don't miss on the basic things like malware or any threats which are due to negligence of employees.
But what about the data sharing? I mean, you are getting data from the hospitals, right? But we don't want this data. How is it being used? Because it could be used for commercial purpose as well. You could give it to an insurance company, etc. So that is when the patients become a little concerned that their data should be safe. What do you do about that?
So there is a consent mechanism from the patient, and only the anonymized data is stored for any analysis purpose or any research purpose. It is no patient data travels across to any hands, and we have ample measures being placed. So since we are regulated in a regulated environment, we do not keep any data which is without the consent of the patient.
Okay, that's great. So in your company, what do you think is the role of tech, IT, or digital, as you call it? You do have your manufacturing facilities, you do have your research centers, and you do have training. What role does technology play, and does the management completely align with the role of IT?
Yes. So as I said, I think just before the pandemic, we were in a very laid-back attitude. We were not in the board meetings or not in decision-making process. I think now, as a technology, we are part of each and every meeting which happens within the organization, and we are early adopters of technology. We are working on almost all the emerging technologies currently in place. And as I told, our MD, Dr. Jitendra Sharma, he is a very visionary and eminent leader. He has been giving us go-ahead in almost all the technology initiatives across.
Okay, that's very heartening, and I think your company is one very futuristic and very agile to the current times, and I think you're just innovating with every new instance. So going ahead, how do you plan? What are the projects that you have on the anvil in 2022?
I think we have a lot of projects. We are looking at deploying intelligent automation for energy, manufacturing, automation of processes through RPA. We have a plan to deploy AR and VR for rehab. We are looking at IoT's deployment in almost all the medical devices. We are looking at a lot of wearables devices which work on AI and ML, which especially for diabetes and other key disease which can be controlled and handled.
Okay, very exciting projects. Now, a lot of people are watching you, especially for those in the health tech sector in our country. Now, over the last few years during the pandemic, we've seen edtech and health tech really expand a lot. Now, what are the challenges that of healthcare and that health tech companies face? Is it about data privacy? Is it about validation? What are the challenges you have seen?
So I think one major challenge which we tried to overcome is so a lot of innovators, they have to come up with products which are regulated and certified before it given to patients. So what we have developed is it's a mobile app. It is an integrated ecosystem. So it provides a platform for innovators and scientific service providers, researchers, and laboratory infrastructure to come together So any innovator who has a product which is at par with the accreditation or a standard which is required, let's say 13485, so it can go and search in that particular app which place I should go to certify it. So do I have a mark? So how do I get the trust of the customer? So that was a missing piece which we had launched in the Global Bio India Summit in 2021 in collaboration with BioRack and KST. So that's one piece which that's the biggest challenge. How do I get my product certified, accredited, and it is safe for the patient? I think that is one thing. Second thing which we are trying is we are trying to tell innovators, be agile, be quick in your deployment. So the technologies are moving very fast. And so if you don't implement it across, don't use it, you will not grow further. I think that's the biggest challenge. People don't get data sets for AI learning model, supervised model. So how do we ensure? So we tell people to institutions to come forward and don't rest in silos. In the healthcare industry, people are in silos, public, private. So let's take in, for example, here, you go to a doctor, he gives you prescription. Now you store it on a piece of paper and keep it in a drawer. Next time you again go to the, you find that file.
You can't find it many times.
Yes. And now how do the doctor analyze your last 10 prescriptions? What medicines were prescribed to you? Don't remember it. So I think that's one piece which the ABDM, the Digital Health Mission, is doing, is bringing together the infrastructure, the architecture to converge and enable the interoperability of the data. So I think there is a lot of resistance in the healthcare industry, and I would urge those healthcare providers, private or public, to adopt to those EMRs which are interoperable through HL7 standards.
But Manish, this is something which is not that easy, because even countries, first world countries like America has not been able to do this very well. Yes, we have examples of the NHS in the UK doing it very well, but it's working in silos doesn't work for anyone.
Yes,
no doubt about that. But this the digital health mission's vision is going to be challenging in itself. So I'm trying to understand what are the opportunities, because now because of the pandemic and the social distancing, people have opened up to using technology for their healthcare needs. But is the adoption complete? Could you expand or build up on the services being given? What is the opportunity?
I think we work with a lot of international agencies like HIMSS and Global Clinical Engineering Practice. We work with WHO. We are the center for WHO pre-qualification for the IVDs. In fact, we manufacture 90% of India's RT-PCR demands. So yeah. So what I'm saying is you have to collaborate. You cannot win. So it has to be win-win for the patient and yourself. If you remain in silos and don't collaborate, you will not advance. So some bigger MNCs would come and take over, and then adoption. Yes, you're right. The adoption is difficult, but India has always been in forefront of anything which is difficult to overcome it.
Right. So could you do a little bit of crystal ball gazing for us in the year 2022? What will be the top technologies that will be deployed and popular in the health tech sector in India?
I think the base infrastructure, I think we are weak in the base infrastructure. I think a lot of doctors don't adopt to the latest technologies. I think that is one thing which most of the hospitals would adopt, is what we call as a hardware refresh in the computer industry. So there would be a hardware refresh for the clinics and hospitals. I think that's the first thing. And going forward, a lot of innovations, a smaller piece would come, which is miniaturization of devices. I think that is going to hit the market very soon.
What about robotics? Because we've already seen some robotic applications in the medical industry, be it for spinal injuries, be it for cancer care. Do you see that also increasing? What else? What are the other technologies that could be in use in the health tech sector?
Yes, robotics is definitely one of the upcoming. In fact, we have a lot of startups within the campus who are working on robotic surgeries. And we'll be coming up with a lot of AR, VR simulations across, especially in rehabilitation space. And yeah, so definitely the data is growing. The data lake has to be established to analyze the data.
All right. And for the for health tech companies, for the CIOs that are watching you, how should they position the role of technology? I mean, because it's usually seen as a cost center. But now, hearing your example, without technology, I mean, how could your company grow? How could your company, give the services that it does? So, is the way technology is viewed being changed now? Are people seeing technology as the necessary must-have, as a profit center, and not just a cost center?
Yes, of course. I think there is a paradigm shift which is happening. So if we see our households, the TV, fridge, for that matter, a digital thermometer, an oximeter, that has taken place in one of the cupboards of every citizen across, especially in the metros. And those cannot be achieved without technology. I think all the health tech companies should make sure that those devices are affordable, because we have been relying more on Chinese products.
Imported products, yes.
Yes. So now we are moving towards self-sustainable manufacturing, which India can sustain over a period of time. Not even import, we are exporting also. And that's what we did for oxygen concentrator. We exported oxygen concentrator, not even made it, we exported it across. Right. So I think that's something which all the health tech should come across, as to make sure that they make quality products, they make it affordable. That's one thing which, and use of software as a medical device, that's next thing which would hit the market, is talking, so machine to machine talking is, so that has to happen. So when you go to an ICU, do you have patient monitor, you have OT and other equipment, do they talk to each other and give a one view to the doctors across?
That really sounds very, innovative and very futuristic. Let's hope all of that materializes very soon in our country, all indigenously done and made in India. Thank you so much, Mr. Kisore, for joining us and talking to us about AMTZ. It's a pleasure speaking with you and having you on the show.
Thank you so much, Anisha. It was a pleasure talking to you.
So that was Mr. Kisore of AMTZ. We're going to wrap up the chat here. Thank you for joining us, and catch us again on another episode.